The moment was opportune to give you a briefing because many of you have been calling us to ask us about the situation with regard to the impact of the COVID-19 pandemic on our work globally and also here in our country. So we thought that the time was now right to try to give you a sense of the situation that we face. As you're all aware, last December, this crisis started in Wuhan in China and has since spread pretty much all over the world. The impact of this pandemic has been staggering in the sense that it has completely disrupted the work of our ministry by virtue of the fact that it has completely disrupted many of the economies and many of the countries around the world. Many of the countries around the world, as you're all aware, are either on full lockdown or partial lockdown. Many of them have ceased to facilitate international travel. Many of the airports are closed. So we are facing an extraordinary situation, the kind of situation that has not been seen in recent memory. As a consequence, we find ourselves uniquely challenged to try to respond to the situation in the world, and we have taken great effort to try to ensure that we remain purposeful, that we remain engaged, and that we remain in touch with not just the diaspora, of which we have, as you know, millions of Kenyans abroad, but our own staff who continue to deal with this situation wherever they are. Now, the biggest concern, of course, for the Ministry of Foreign Affairs is the issue related to our diaspora. Now, it's not possible for me to be able to give you a country-by-country report because, as you know, we are in over 54 countries around the world where we have missions and embassies, but we also have a footprint of other kinds of engagements around the world that is almost reaching 130, 140 countries. So we have a very large footprint. And in almost all those countries, there is a Kenyan or two, or quite a few, as in the case of North America, Europe, and Asia. So I wanted to give you a sense of some of the issues that we are faced with and some of the challenges that we continue to deal with on a daily basis. In the case of North America, in the United States in particular, we have seen the reports. United States is now the most affected country in the world. The statistics you have, we shall share them with you later. I don't need to go one country after the other. But what I wanted to emphasize here is that we have a very large diaspora in the United States, and many of them are severely affected by this crisis that we are facing. For many of them, as you know, the United States has lost over 6.6 million jobs just in the last 1 month. And many of those of our people in the United States have also lost their jobs, particularly those who are doing temporary jobs, those who are doing what they call part of the gig economy in the United States. Many of those have suffered unemployment, deep underemployment as they face the challenge of their work. Now, we have also seen the situation related to deaths in the United States. When I last looked at the statistics, the United States had over 20,000 people who had died from corona-related circumstances. And these were mainly people from hospitals. This did not include the numbers of people who may have passed away in homes and other old people cares, homes and such places. So far, we have on record about 5 Kenyans who have succumbed not necessarily to COVID-19, but who have died in the last month and who have underlying causes that could have made them susceptible to COVID-19 conditions. As you can well imagine, getting information has not been easy, but we do have that list, and we shall be able to share with you that information later to give you a sense of who those are who have passed on in the last month or so. The situation in Canada is not as bad as the United States, and we have had no case of any Kenyan who has passed on, and therefore we remain grateful that situation, even though challenging, even though everybody is on lockdown, even though everybody has to stay home, that they remain safe, and we continue to work very closely with our mission there to make sure that we observe in that situation carefully. But let's be clear that this situation globally will remain with us for anywhere between 3 to 6 months. And as a consequence, we have to be prepared to face up with this situation, and particularly with regard to the fact that the lockdown might affect international travel, which means that many of our people in North America and elsewhere may have a real challenge coming home. The situation in Europe is not much better. As many of you are aware, Italy, France, the United Kingdom, and Spain have been severely affected. They are having upwards of 700 deaths a day. Sometimes at the peak of it, over 900 deaths a day. We have had, and we have remained in touch with our diaspora in many of those countries. We are thankful that we have not had too many cases of people who have been affected. In Spain, we have only stranded passengers, of which we are trying to figure out how we can get support to them, including a student. In Hungary, we have 21 students who have been stranded there for a long time, but we have continued to work with the government of Hungary to provide assistance to them. In France, we have 61 training assistants who have been stranded there, and we continue to work with the government there. I don't have to tell you about the situation in the UK. We don't have the full statistics because we have a very large number of Kenyans who reside in the United Kingdom, and we continue to keep a sharp eye on them. We have continued to remain engaged. Our embassies continue to remain engaged and continue to reach out wherever they can. I think you should all be aware that every single one of these embassies is now working from home. None of them are able to work and go to the office, and so they are working virtually. This has complicated the situation severely, but it is something that our ambassadors and our officers continue to respond to so as to be able to rise to the challenge that they face. In countries like Poland and Greece and Cyprus and Malta and countries like that, we are working with them indirectly because we don't have a mission there, but we do have missions here in Kenya, and also we do have a relationship with those countries through embassies that are based elsewhere in Europe. The situation in the Middle East is equally concerning. We have very many Kenyans working in the Middle East. Many of them have been affected by this situation. A significant number of them have lost their jobs. This is a worrisome situation that we are trying to continually monitor. We have had some countries like Saudi Arabia who have announced that they will continue to support all the people who are there, which is a very positive thing. But we've also had other governments in the Middle East expressing their willingness to continue to support Kenyans who are there, in as much as they will not have them evicted and or put out on the street, which is something that we are very concerned about. We have been in touch with all governments around the world. We have written to them to ask them to look after Kenyans, to continue to reach out to Kenyans, just as we are continuing to look after the international community that is here in Nairobi, to make sure that no harm comes to them, that we do our best to set up the best systems, to provide the best healthcare, the best response to this COVID-19 crisis, to ensure that all the international people who are based here in Kenya are safe. This is our commitment, but it is also our hope and our expectation that the same thing will be done by all the other countries in the world. In Asia, we continue to see a similar situation as we see in the rest of the world. As I said earlier, this epidemic started in China, and we saw the greatest impact early on in China. As many of you are aware, we have close to 3,000 Kenyans in China, maybe even a little more. Some of them are not registered, so it's hard to be able to keep tabs of everybody. But we don't have in China a single case of a Kenyan who has succumbed to COVID-19. And this is a remarkable thing when you imagine that the crisis started in China. And if you recall, we have students who are stranded in Wuhan city, which was the epicenter of the crisis in China. And we remain very grateful that the Chinese government was able to secure the well-being of all those students. And as the lockdown is now being lifted, some of those students are now able to move around China once again. Now, you have heard in the case of China about the situation in Guangzhou province. And this situation has been extremely worrisome to all of us. In the case of that situation, you know, there have been reports in the social media, and some of our parliamentarians and senators and politicians have been very concerned about their constituents in Guangzhou City and in that province. The reality is that this has been a very unfortunate outcome. Africans, Kenyans included, have been discriminated against in the process of the government's response, the provincial government's response to trying to mop up the situation that they are facing there post the crisis that they had over the last few months. The government there has been working very hard to make sure that there is no resurgence of the COVID-19 epidemic in China. And some of the provincial governments have been over-enthusiastic, and sadly they have discriminated and targeted various foreigners in their response. However, I think you know that the African Union has responded collectively in consultation with us, and we're very happy with the way in which the chairman, the current chairman, the president of South Africa, issued a statement, which I think you should all have seen by now. We were consulted in the development of that statement and in the issuance of that statement. In China itself, our ambassador and her team have continued to work very hard to reach out to all of our diaspora in China. China is a big country. It is an entire subcontinent. But nonetheless, we have continued to try to reach out to our diaspora. And I can tell you that any time anyone has been brought up to me individually, let alone the ambassador in China, as having been affected negatively by these circumstances where Africans and or Kenyans have been discriminated against, we have taken up that matter directly. And every single one of them that has been brought to our attention has been resolved. In the case of our Chinese embassy here in Kenya, they have remained engaged with us. The ambassador here has been open to us, has been very facilitating. In fact, it was he who took up the challenge early on to make sure that the government of China recognized that as far as the situation that was affecting Kenyans was concerned, that this would be handled expeditiously, and that Kenyans would be given the right kind of protection that they deserved. So this is something we take extremely seriously and we remain very seized about. We're happy to report that the situation is stabilizing in those, and we are seeing progress. I think if you look at the media, social media reports and other official media reports, we are seeing that the situation that we were facing last week is not the situation that we are facing this week. We have seen significant progress, and that is because there has been a serious attempt, both by the African Union, by our ambassador in China, including working with our colleagues, especially our colleagues from Eastern Africa, together with the Ministry of Foreign Affairs of China, to try to make sure that this situation does not get out of control. What is important, however, is that we send a message to our friends and our relatives and our students in China that it is really important that they remain disciplined in the way in which they engage with the government of China, particularly when it comes to testing, particularly when it comes to protecting themselves, particularly when it comes to adhering to the rules and regulations of China. Because it is because those rules were implemented, it is because people took care and followed the instructions that were given by the Chinese government that we haven't lost one single Kenyan. This is a remarkable thing when you realize how many there are over there. Another country that we are looking at very closely in Asia is India. In the case of India, India is a very concerning place for us. As you know, India is on full lockdown. No flights can go into India, and we are unable to be able to facilitate any kind of travel of Kenyans out of India. We have registered over 64 Kenyans who have been caught up in the lockdown in India. These were people who were there for medical purposes. And we even believe that there are more. Our estimate is that we have about 160 Kenyans who have found themselves on the wrong side of the lockdown in India. They had gone there either as patients or as accompanying patients for treatment. The situation there is concerning. Some of them have run out of money because obviously they were not expecting to stay there for such a long time. Some of them, sadly, have lost the patients with whom they went for treatment. And this is tragic. But they're not able to bring their loved ones home. This is something that we continue to discuss, and we have taken up with the government of India, and we hope that we will be able to find an amicable solution that will work for everybody. But I think it's important that we send a very clear message to all of us that just like in Kenya, where we have said that a COVID patient should be laid to rest within 24 hours of passing away, we should be prepared as Kenyans caught up in these situations around the world to also allow us to lay to rest our loved ones abroad within a very short period of time in those countries. Because bringing those bodies home is going to be extremely difficult under these current circumstances. It is something that we have to think about and that we have to really seriously contemplate, because the situation for those who are very ill is quite dire, and for those who have passed on, it is something that needs serious consideration by the various families. Maybe the time has come for us to allow our loved ones to be allowed to rest where they have fallen. There are other, of course, examples of countries. In Australia, further afield, we have quite a few Kenyans who are stranded over there. Many of them had traveled as tourists. I think we're about 18. In countries like Iran, a very worrisome case. We have over 200 students out there who have not been able to attend school because of the circumstances, and they are struggling because they cannot leave. We continue to try to work through our embassy to reach out to them, to make them know that we care and that we continue to keep them in our thoughts, and we continue to try to find solutions for the circumstances that they face in their various countries. I would also like to spend a few minutes, if I may, talking about our staff. I don't have to tell you how difficult it has been for many of our embassies and our staff abroad to deal with the challenge that they are faced. Many of them are inundated with demands for help, but I think anyone who is clear-headed and thoughtful about the situation that we are facing in the world, this is not a Kenyan situation, but a situation that we are facing in the world, will recognize that it is simply impossible for us to be able to be as responsive as we would normally like to be. You know that Kenya is an exemplar on our continent. Many times we do send aircraft or help to our diaspora who are caught up in situations abroad. Remember the situation in Libya, for example. But you see, that was an incident where there was total chaos and a war was raging and planes could fly in and fly out. And so it was possible to consider that we had a small number of Kenyans who we could extract quickly and save their lives. But when you're dealing with hundreds of thousands of people, then the proposition is completely different. We have to wait until this situation blows over. We have to wait until the lockdowns in the various countries end. This is something that we have to do. And our staff are under a lot of pressure. Some of them facing life-threatening circumstances in the countries that they're in. And so it is important that somehow we continue to provide support for them and give them the kind of assistance and help that they need. Other than the situation regarding our staff, I would like to appeal to the diaspora around the world to continue to remain understanding of the situation and to continue to work closely with the ambassadors abroad, including with our staff, so as to try to give them to allow our staff to give them the best possible support they can under the circumstances that they're in. Let me also end with a sad note regarding our staff. Let me just look up that document. 2 days ago, sadly, we lost one of our colleagues in Los Angeles. And we issued a statement, which I think all of you got. Ms. Ruth Anyango Ogonda passed away in Los Angeles on Friday, the 10th of April. She was taken suddenly ill. She had some underlying conditions, high blood pressure, difficulty in breathing, and she was rushed to hospital, but sadly she passed on. We're waiting for the autopsy to be able to determine the cause of death. She has left a daughter of 25 years old and another who is 6 years old. Our embassy, our consul in LA, working under the guidance of Ambassador Njeri Karago, has been reaching out to them to ensure that they get the right consular counseling services, to ensure they get the support, to ensure that they get the comfort that they need to be able to deal with this devastating loss of their mother. It's very sad because they had also lost their father not too long ago. So they have now been orphaned. What is tragic, of course, is that we are not able to bring them home under the circumstances that prevail right now. But we shall continue to ensure that they are kept in the best possible condition at home in Los Angeles. I'm happy to take any questions now. That was
Kenyans who are affected by this situation, and maybe the number of Kenyans who are implemented. Then the other question has been, where is the ambassador or ambassador in China? Because definitely Kenyans who are there, maybe they want to see her, maybe they want her to issue a statement or something of the sort. It's a concern that maybe it's out there.
okay. First of all, I think the numbers that I have about those who are affected, out of the thousands that we have there in Guangzhou, are 100. Okay. Now, that's a guesstimate, because as you heard from your colleague here, there's a lot of people who are there as unregistered aliens. Okay? And what happens when you have a crisis is that if you're living in a country unregistered and illegally, when there's a crisis, you get smoked out. Because, for example, if you're living too many in a flat, then the rules are now applied forcefully because you're trying to save people's lives, you're trying to stop the spread of the virus. Then you find yourself out in the street. So indeed, you're right that this is a challenge for us. But for the vast majority of Kenyans in China, and when I say vast majority, I'm talking about 95, 97%, we have no issue. No issue. So we have a minority that is affected, but we have to worry about that minority because they are Kenyans. So we have to reach out to them. And remember, they are constituents of certain members of parliament, or, and they care for their constituents, even though those constituents are in China. So we have to worry about them too. About Ambassador Serem, seriously, if we have an ambassador who has shown herself to be dedicated and outstanding, anybody who has followed her on social media, I'm sorry, you cannot fault that lady for the work she has done for Kenyans. If people don't register, if people only turn up once they have been evicted, then they rock up at the embassy when the embassy is on lockdown. And then we have to figure out how to reach them on lockdown. You tell me how that situation is going to play out. I think she has shown herself to be very resilient. She worked right through the crisis. Remember, when the crisis started, she was here. She didn't have to go. She could have said, Sasa, Naumwa, or whatever, because something. But she picked herself up and flew right into the crisis and took leadership of our office and has demonstrated amazing resilience in the face of a very, very difficult situation. So that's why I was pleading with our diaspora to please be understanding. Yes, it is painful to be thrown out in the street with your suitcase. I agree. It is painful not to know where your next meal will come from. I agree. But it is not fair to blame that on the ambassador or anybody else in the mission, the embassy. In fact, you should be asking them for help, not to apportion blame to them. Yes, please.
My name is Brian Obuya. I work for KBC News. But Ambassador, you realize that our main concern here, we're very concerned, even ourselves, about the situation in China. And I would say I've listened to a number of things you mentioned, which are actually in order. But we fail to hear one thing. We fail to hear what we are going to do as a government. These people could get registered, we could have flouted some rules, but they are our people. Mm-hmm. The Daily Nation reported that.
Let me make a small correction here, because we don't want to declare anybody having passed on when they haven't. I'm reminded that the Kenyan in Sweden is in the ICU and is making good progress, as well as the one in Germany, who is actually from Italy, and was evacuated to Germany, a Kenyan, and is making good progress. So we are thankful to those governments for everything they continue to do for Kenyans. One thing I forgot to mention to you that I think I should. We have been working very closely here in Kenya with our diplomatic corps. With the United Nations, I think you've heard recently that there was a fund that has been put in place to try to raise a certain amount of money under the leadership of the resident coordinator. We are seeing that there's a concerted effort to bring together the United Nations agencies. We are seeing a good response from UNICEF, from UNDP, from IOM, from UNHCR, particularly because we are very concerned about the refugees in our country. And this is, as you know, a Ministry of Foreign Affairs docket, including, of course, Ministry of Interior. And so we are working very closely with these organizations to make sure that we support each other and that they provide us with whatever support they can so that we can move this process forward. So I wanted to make sure that I do not forget to mention the United Nations organizations. But let me also mention the individual embassies that are here. We have, as you have seen, we have received a lot of support from China. The Chinese government has sent us many test kits. The Jack Ma Foundation has been very engaged with us. Ambassador Serem has been engaging in her own private sector fundraising in China. And some of the goods that arrived last week on Friday came from her and her office's attempts to raise supplies, including ventilators, which were shipped to Kenya last week. Like I said, she has been an exemplary ambassador, and I think we should give her all the support that she needs. But we're also looking for support from other countries, including the United States, in spite of their situation, including countries in Europe, because they have, in some cases, extra supplies, extra resources that they can share to help us overcome the situation that we are facing here in Kenya. So I thought it was important for me to mention that. We are also working with the diplomatic missions here on evacuations of their nationals. As you know, many tourists were here on holiday, and some of them want to go home. So we've been organizing a series of evacuations for them to go home, and this has been working very well, and we are very pleased with the progress with regard to evacuation. Kenya is the destination country for medical evacuations for the United Nations in Africa and even in some Asian countries. We are the destination country. So we have been receiving evacuated people brought in by the United Nations, but also by other countries who have been asking us for help to try to treat their people because they are not able to get support from their usual sources. So we remain an evacuation destination, and we're very proud of this. And we are very proud of the fact that our medical fraternity in Kenya is considered of the quality that you can evacuate people here from other countries so that they can receive treatment in Kenya. And this is something that we continue to be very proud of and we continue to support. So there are many, many things that we continue to work on and that we shall continue to work on moving forward. So I just wanted to give you those quick highlights so that I don't forget that there are other things that we are doing that are very positive and that help us all make our country proud, even under these very difficult circumstances. Asanteni sana. Huh? I can't hear you. No, I don't think there's any deaths. Sorry. It's just the one in ICU. Yeah, correct that, please. All right, thank you very much.